Hi, this is Dr. Subakar, Clinical and Interventional Pulmonologist, KIMS Hospitals, Kondapur Division, Department of Pulmonary Medicine. Today, I am going to say an interesting case of chronic cough in a 14-month-old baby. The patient present to KIMS Hospital with chronic cough from past 6 months, that is from the age of 8 months. So, the patient was further evaluated. With suspicion, we did a CT scan which showed an radio-opaque object in the left main bronchus, completely occluding it with partial luminal filling distal to it as well as collapse of the left lower lobe. So we thought there was some foreign body. The baby's mother did not know or did not give any history of any foreign body ingestion or aspiration. So we went ahead with a rigid bronchoscopy with 3.5 size outer barrel, and after we went in, we saw something which was very glistening. On touch, it was very gritty. When we tried to catch hold of it, it just displaced and went down. When it displaced further, we could see all the granulation tissues behind the place where it got impacted. The foreign body got displaced and dislodged posteriorly. We went in, then we could see that there was multiple granulation tissues causing narrowing of the lumen. And the interesting part was the part distal to the impaction was collapsing. So we had to carefully go in, wedge the scope with a flexible bronchoscope, and we have to irrigate it with saline so that the patency of the lumen could be maintained. It was found in the lingular segment of left upper lobe. Again, we thought how we could reach over there. With no choice left, either to take the body or to refer it to the surgeon, we carefully negotiated or we carefully moved the rigid barrel deep into the left side till we reach the secondary carina. There we could wedge it and we could maneuver a bit, and then we could catch hold of that foreign body from the lingular lobe with the help of a rigid forceps and carefully remove it. The patient went away home after 5 days of total hospital stay. Thank you.